Hello and welcome to the Hennepin-Regions Psychiatry program. I'm Scott Oakman and I'm here to give you a short introduction to this unique program. My motto since joining this program has been this: we are part of two amazing cities and two great hospitals, but we are one awesome program. And what makes it awesome are these people, our residents, and I can't emphasize enough for you how proud and privileged I am to work with these people. I hope that you get to know them too. So our program aims are this: to train psychiatrists. We are a clinically focused community psychiatry program, and that is what you will see emphasized throughout our training. And in light of that, we are ourselves a community within that community, working together to reach those goals of being clinically excellent, academically informed, and culturally competent psychiatrists serving our communities. As you meet with us on other programs this year, I hope that you'll be asking yourself these questions to help you find the program that is right for you. Who will you learn from? Who will you train with? And what will you be a part of? And finally, where will I end up? Remember that your best teachers are your patients. And at Hennepin and Regions, we're very proud of the breadth of clinical exposure that you'll receive, the diversity of our patients, both in terms of diagnostic categories, socioeconomic status, and ethnic diversity. You'll also want to be paying close attention to who you're training with and the community that we are a part of. Are the people that you're training with people that share the same values that you do with respect to the care for the mentally ill? And finally, don't lose sight of the outcome. What kind of psychiatrist do you want to be 5 years from now? Our track record is one of turning out really well-trained community psychiatrists who fill critical needs in our community, but also will have no problem finding the jobs that they desire anywhere. A couple of thoughts about our hospitals. Both Hennepin Healthcare and Regions Hospital are solid clinical training environments. These are full-service tertiary care flagship hospitals of their systems. They're nationally recognized and locally respected as teaching hospitals and are major training sites for the University of Minnesota. Both hospitals were founded with a mission to the community that we serve, reaching out to underserved populations and providing health care for those most in need. We also have a very strong quality improvement and health equity emphasis, and emphasize building diverse and inclusive workplaces to serve our communities. At Hennepin Healthcare, which is Minnesota's first teaching hospital, psychiatry is one of 15 sponsored programs containing 300 residents and fellows. We do our core rotations here in adult inpatient psychiatry, in acute psychiatric services, emergency psychiatry, and in consultation liaison psychiatry, where we now have a fellowship in that discipline. We have clinics serving adult and child outpatient needs, which you will train in, and extended outpatient programs such as partial hospitalization and day treatment, women's health programs, addiction medicine, a mother-baby partial hospital program, and a sleep disorders program. We also partner with a psychology internship training program to help provide intensive training in psychotherapy. At Regions Hospital, where I work, you'll also have a lot of your core inpatient mental health rotations. At Regions, we follow a hospitalist staffing model. So each of these 5, soon to be 6 floors of 20 beds each is staffed by a pair of physicians who alternate 7 on and 7 off with the partnership of a physician assistant. We also train in consultation and emergency psychiatry at Regions. We have a partial hospital program called Daybridge, and we are the heart of the health partners in Park Nicollet network of adult and child outpatient clinics through which you also will have the opportunity to rotate. We are affiliated with 2 hospitals in western Wisconsin, Hudson, Wisconsin, where you will rotate for addiction psychiatry at our Programs for Change program, and Amory, Wisconsin, which has a rural inpatient psychiatry program. We're partnered with Methodist Hospital, which is the home of Melrose Center, which is a inpatient and outpatient eating disorders program as well. As I mentioned, we are a community psychiatry program, so our focus and emphasis is on serving the community. We focus on social determinants of health as they affect our patients, on diversity and inclusion, and on advancing equity in healthcare in our community. To get you the widest possible exposure to these patients, we also rotate at a number of other sites in the area. County mental health centers, private clinics, Allina Hospital units on inpatient psychiatry and geriatric psychiatry, the Minneapolis VA for geriatric psychiatry, and the Hazelden and Betty Ford Foundation for another perspective on addiction psychiatry. This is us. I have been the program director here for 9.5 years, and I am looking forward to turning that position over to Dr. Stamatis Ziris in April. I will remain with the program as Associate Program Director, particularly focusing on the Regions and Health Partners aspects of the program. Dr. Ziris has been our Associate Program Director for the past 2 years and has brought a lot of energy and improvement to our outpatient training environment and our didactics, and I'm looking forward to continuing to partner with him. We've already done a lot to work out a very smooth transition. So far from riding off into the sunset, I'll still be hanging around to be part of the residency training. 2 other important leaders in our program are Amitabh Tipnis, who's an Associate Program Director on the Hennepin Healthcare side, and J.J. Racimus, who is our Fellowship Director for Consultation Liaison Psychiatry and takes a very strong role in the education and supervision of residents. We are led by 2 very distinguished chairmen. Dr. Colon has been with Hennepin Healthcare for decades, leading the Consultation Liaison Psychiatry Department, and is really a great role model and support for the program. Joshua Zimmerman is our Senior Medical Director for Behavioral Health on the Health Partner side and is also extremely supportive of myself and of the program. Now, lest you think that this is some kind of men's club, I would like to point out that our bosses are all women. Dr. Walsh in particular has been an absolutely vital mentor and advocate for all of our trainees. And I think it's pretty cool that both systems are led by women at the top. This really influences the culture of these organizations, which are extremely committed to advancing women and people of color in their careers in healthcare. In addition, we have over 50 active clinical teaching faculty across all psychiatric subspecialties. We will work with you in hospital-based and community settings to help you develop into the best psychiatrist that you can be. You will benefit from the leadership of psychiatrists with literally decades of experience in treating the mentally ill in our community. Now, who's really in charge of the program? Hopefully you've already met Sandy or Chris through the process of scheduling an interview or during today's interview, and you'll start experiencing how they support and tend to our residents and keep things moving smoothly and support our residents at every stage of the process. Our job, as I've said already, is to develop psychiatrists. And my philosophy is that this is something that is primarily caught, not taught. I tell residents that I probably only remember 3 or 4 specific things from didactics in my own residency years. But I've learned so much more from my patients' stories, from peer interactions, and from faculty wisdom that I've received along the way. Didactics are important, and we've put a lot of energy into improving them. But where you grow as a clinician and as a person is by experience. Like Dr. Zhang here, who was informed from a Halloween Muppet as a PGY1 to a chief resident and is now an attending at United Hospital in St. Paul. The overall structure of our program has you doing a lot of psychiatry right away in your first year. We ensure that you complete your required primary care rotations for your licensing and board eligibility, and then build on that foundation, moving you on into the outpatient world in your third year and deciding what kind of practice you'd like to have in your future. We've set up the program so that anyone who might want to transfer out after a third year to a child fellowship will have all of their requirements completed, and those who stay have a full year of elective time to deepen and refine their skills and professional development. All years of our residency have a protected half day of didactics, which you are excused for regardless of what service you might be on. We provide supervision and mentorship along the way on all of your rotations. And along the way, we also test you regularly. You take an annual in-service exam called the PRITE, and you do clinical skills verification exams with faculty to test your interviewing skills and your assessment and formulation skills. Our desired outcome is that you will be a board-eligible, practice-ready psychiatrist. Our track record is actually quite good. The last 5 to 8 years, our board pass rate on the first try is up over 80%. And the last 3 years, we've passed 86% of our graduates on their first try, especially if they are taking it in the first 2 years of their eligibility. As I said before, we're looking to fill a critical gap in American healthcare. About half of the psychiatric workforce in Minnesota is within 10 years of retirement, and Minnesota's 3 residency programs can't keep up with the anticipated demand. 70% of our grads are employed within 40 or 50 miles of these hospitals. And as you look at our last 2 graduating classes, 13 out of the 16 smiling faces that you see here have started practice in or near the Twin Cities, and 6 of them within our own systems. So even if I emphasize career and vocation a bit, these are still extremely academically oriented hospitals. These are major teaching sites of the University of Minnesota. You will be overseeing medical students and teaching them. You will be presenting for monthly grand rounds and be involved in interdepartmental quality improvement initiatives. Both hospitals actively seek resident input into committees and institutional leadership and are phenomenal sites for interdisciplinary learning. We dedicate a half day a week in your third year to research and scholarly projects. My philosophy has been that this is something called opportunistic research. In other words, you see something and you decide to go into more depth in it. And sometimes that results in a poster or a workshop that you can present at a national meeting. If something really catches on, there's plenty of fourth-year research elective time available. And if you do get an abstract accepted at a national meeting, we have some travel funds available so that residents can be presenting this at national meetings. Hopefully, we'll be able to travel again someday soon. As a community of learners, we are also part of the wider community of Minneapolis and St. Paul. Here in the Twin Cities, we had a major wake-up call last summer. The George Floyd murder and the unrest which followed directly affected many of our residents, students, and staff. The healthcare community in the Twin Cities, including our residents, is committed to advocacy and equity, learning more about the disparities that led to that moment, and how we can address them moving forward. I think it's not enough to just show up for a demonstration, although oftentimes that's a good place to start. But as a program, we try to nurture advocacy, service, and understanding of what our patients' lives are all about. We provide opportunities to volunteer and to show solidarity with our patients and our hospitals in helping to advance the healthcare in the community. Residency is not just about developing psychiatrists, but about developing people. Psychiatry is hard work. It's physically and emotionally exhausting, whether it's being on call or just getting a late admission or a consult on a Friday afternoon, or having a patient who has a very difficult problem take extra time in your clinic. As your attendings, we've been there. We know what this is like. And we've really tried to put mechanisms in place which support and care for residents. Not just in our program, but throughout the hospital. We emphasize early recognition of stressors, instituting self-cares. We've been providing dedicated residency health resources and encouraging time for residents to engage in their own personal psychotherapy. And then there's our parental leave policy. Honestly, I can't even keep track of how many residents have brought babies into the world the last couple of years. Now, we don't guarantee that you'll get a baby if you come to residency here, but we want you to know that you have that option and you'll be supported in it, sometimes even twice. I know that a lot of life happens in these years of medical school and residency. I started med school with 2 small children, finished it with 3 and 1 more on the way. We know that in developing people, we want you to be ready for the long haul, for a sustainable career. And we want to support you with shared values, a workplace that is healthy in every respect. The bottom line for me is that I want you to want to be our colleague when you finish residency, as many of our alumni do choose to come back and work with us. We value our families and friends, and I know that you do too. You can see my family down at the lower right-hand corner. My grad school baby, my med school baby, my residency baby, and my fellowship attending baby. I hope this has given you a good view of who we are. And beyond that, there's just one thing that I have left to say. Come join us. Be a part of our community. We look forward to meeting you and hope that you will be one of these smiling faces in next year's intern class picture. Good luck with all of your process working through this crazy thing that's called the match.